As the President and CEO of Gwinnett Health System, I'm proud of the efforts that our associates and partner physicians make toward our deserved excellent reputation for service, quality, and safety. It is this reputation that fulfills the foundational vision of being the health system of choice for our community. Our reputation is clearly reflected in consistently high customer satisfaction and many national awards. However, as we all know, quality is no accident. It takes focused effort, clearly defined processes, and teamwork. As part of our ongoing effort to ensure quality patient care, we have produced this training program that defines the role we all play in continuing the excellent service to our patients. Quality and safety is not a matter of a Joint Commission mandate. They are the right thing to do and what our patients expect. So now join me as we take time out for patient safety.
Any profession or pursuit where a mistake can prove life-threatening has an established series of checks and balances to ensure a safe and desirable outcome. For instance, a pilot would never take off without first conducting a walkthrough and pre-flight checklist with his co-pilot and flight engineer. A rock climber or mountaineer always has someone check his knots and harness prior to the start of a climb. No matter how many times he has climbed and how easy the climb is perceived to be, the best know that mistakes happen, and the consequences are quite often irreversible. The GHS system of checks and balances is the timeout process. For us, a timeout is our way of checking our knots and harnesses and documenting our flight plan. Our timeout is designed to reduce the likelihood of human error that can result in serious complications for our patients. The only thing that matters during a timeout is patient safety. Personal feelings, procedural hierarchy, and fatigue take a back seat to our goals of enhancing patient satisfaction and maintaining clinical quality.
It's important for physicians to take ownership in this important safety protocol. All doctors, nurses, and staff in the room need to participate in this important process to make sure that we keep patient safety at the top of the priority list.
Let's look at a timeout to see how the procedure looks, or maybe how it shouldn't look.
Time out! Time out! This is our timeout. Patient.
Yeah, 2. It's got to be 2.
Are we going to do the timeout?
2. 2. Right, that'll work. Right.
This is our timeout. 56 acrosses.
Obviously, that's no way to do a timeout. Now, let's look at the way timeout should be done.
While the exact format and procedure has some flexibility that can vary based upon the procedure type, the model is exact and clearly defined in the 6 corrects of a timeout and the guiding principles. 6 corrects of a timeout. Confirm the correct patient, side and site, procedure, position, equipment, and consent. Remember, a timeout is always conducted at the location of the procedure immediately before the procedure. Now let's look at the timeout guiding principles. 1. All team members are actively involved in the timeout. 2. Timeout is initiated by the procedure team leader. 3. All team members verbally confirm all timeout elements. 4. Any concern or question during a timeout must be voiced immediately. It is the right and responsibility of all team members to protect patient safety. 5. Timeout is accurately documented as soon as possible after and never prior to the timeout occurring. Done properly, timeouts don't have to take a long time.
We're ready to conduct our timeout. Anita Thornton, 202461. We're doing EGD, and she'll be on her left side.
I agree.
I agree.
This is our timeout. Patient James Roulette, right foot dorsal tendon repair. Right foot.
Dorsal tendon repair.
I agree.
I want to go ahead and do our stop timeout procedure. Okay, I've already verified that there's an informed consent on the chart signed for a central line insertion on Mrs. Josephine McFall. On the telephone, you had told me that we were going to be doing a right subclavian central line insertion. Is that correct?
That is correct.
Okay.
Morning, everyone.
Oh, good, you're here. We're going to do a timeout. This is Paul Martin. Mr. Martin, what's your birth date?
1/12/1955.
All right, we're going to do a left heart cath. We're going to use the right groin. Do we all agree?
I agree.
I agree.
All right, I'm going to give him some sedation.
The timeout process, when done correctly, only takes about 10 seconds. We all have time for that.
When things don't go as smoothly as we want, confrontations become a part of the timeout process. And remember, a confrontation is not necessarily negative. It just requires everyone to be open to feedback. Let's see how a controller can enforce cooperation while maintaining a positive team atmosphere.
Okay, it's time for the timeout.
No, we're fine, thank you.
Doctor, we can't proceed without the timeout.
No, it's good. We're okay. This is my patient. I understand.
I understand, but I'll have to get my supervisor if I don't do the timeout.
Fine, just do it.
Okay, thank you. All right, the name of the
timeout
patient?
process is the right thing to do, and it's something we should want to do to protect our patient's safety.
Confrontations are an important part of the timeout process. We all need to have the courage to alert the team when we note anything that has the potential for harming a patient. Team members should use a safety stop whenever we believe that a mistake is made or if anyone is not fully cooperating with the timeout process. If we err, we will err on the side of patient safety.
And we're working on the left arm for carpal tunnel release, is that correct?
That's correct.
That's correct. No, wait, safety stop. That's the right hand.
What does my H&P say?
It says left hand as well.
Call and confirm.
Okay.
If the safety stop proves unnecessary, so what? A few seconds is all it takes to prevent a possible lifetime consequence.
As a physician, it's our responsibility to make sure the timeout happens and happens correctly. I'm Dr. Shore. I've been in your shoes, and I know timeout is worth the effort.
Having worked in the healthcare industry for over 25 years, I know how fast-paced and high-pressure the environment can be. On a daily basis, our associates perform in a manner that makes me proud to be your president and to be part of such an inspiring team. My goal is to continue to enhance our historically strong service and quality while communicating to our patients, associates, and partner physicians that in many ways there is a new day in Gwinnett. We welcome your feedback and truly appreciate your active participation in the timeout process. On behalf of all of us at Gwinnett Health System, thanks for all that you do.